Any pain here?
No, just tight.
Just tightness.
Yeah.
More tightness on the right side,
Yeah.
yes? Okay. Any pain or discomfort here?
Yeah.
Right side?
Yeah.
Yes?
Just tight.
Any pain or discomfort there?
Just tightness.
Just
again.
tightness.
Yeah.
Left side?
Yeah.
There we go. So we got a small leg length. All right, and down. And your left leg. Okay, so it's slightly higher. Any sensitivity when I push on there?
A little bit, yeah.
A little bit. Okay. And exhale. You good?
Yeah.
All right. Me? Okay, great. And down, and your left leg. Much better. Okay. Again here. How does that feel? Good. Okay. How's the tightness there? Any tightness at all?
No.
No? What's up, everybody? Dr. Ranyan here. Happy New Year and all the best for 2025. This is our first kind of video shoot for the year. Today we have Rosie with us. Rosie is a personal coach based here in Dubai. We've just been through her case history, and today she comes in with lower back pain. She has a 4-year history of lower back pain. The pain is on and off. Her most recent episode was this past weekend. For the most part of it, she seems to be able to manage her pain herself. Obviously, being a coach, she's able to rehab herself. But we want to kind of get an idea of what's going on, why the pain keeps returning and is on and off. So we're going to start with our orthopedic examination. And hey guys, make sure to like, subscribe, and make sure to comment. We'll be happy to answer any questions. All right, let's get going.
Ready?
All right, let's check if your reflexes are working. Okay, so for those of you who are new to the channel, on our case history, Rosie does not experience or is not experiencing any neurologic symptoms. So no numbness, no weakness in the foot or in the leg, no radicular pain. Regardless, I always like to start with a neurologic examination because we could find something in dysfunction that the patient's not aware of, and it will give us an idea of how we need to manage the patient. All right, let's get you to lift your toes up for me, please. I'm going to push down, you resist for me. Good. The side. Push, 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 push. Good. Toes down. Push down. Good. Push down. Good. All right. Oh, one more thing. Can you feel this?
Yeah.
Same both sides?
Yeah.
Here?
Yeah.
And here?
Yeah.
All right, great. So you can see I'm a little bit rusty. We haven't shot in a while. All right, let's go. No, you're gonna stay seated for me 1 second.
Okay.
Can you straighten your left leg for me? Point your toes towards you. Towards you.
Me?
Yes. Chin down, and then slouch forward. Any pain in the lower back or stretching in the left leg?
Stretching in the left leg, yeah, my hamstring.
Okay, you're gonna sit upright for me. So we're gonna consider that normal. I want you to remember that. We're going to compare to the right side.
Okay.
Can you straighten the right leg for me? Toes towards you, chin down, bend forward. Any pain in the lower back or stretching in the right leg?
There was more stretching when I was sat upright, but
More
now
stretching
no.
when
I
you're
was
upright?
Sat here,
Yes?
yeah.
Okay. And as you bend
But
forward, it
here
gets better?
Yeah.
Okay. Any pain in the lower back?
No.
No. All right. You can stand for me, please. So that's a slump test. You're going to turn for me, face that way. Slump test is a nerve root compression test. It basically stretches the nerve from the lower back to the foot, and then bending forward basically increases the tension on the spinal cord. So it's maximum tension on the nerve root. All right. Relax for me. Any pain here?
No, it just feels like it needs to pop.
Okay. Any pain here?
No.
Any pain here?
No, just tight.
Just tightness.
Yeah.
More tightness on the right side,
Yeah.
yes? Okay. Any pain or discomfort here?
Yeah.
Right side?
Yeah.
Yes.
Just tight.
Any pain or discomfort there?
Just tightness.
Just
again.
tightness.
Yeah.
Left side?
Yeah.
Okay. Can you bend forward for me, please? Just hinge from the hip. Yes. Slowly, and stop if you get any discomfort in your lower back or in the right buttock.
That's fine.
Nothing?
No.
No issue. Okay. All right. Let's get you to lie on your back for me, please.
This way?
Head here. Okay. So, right side. Let's start with the left. Okay. Leave your leg loose for me. Any pain in the lower back? Stretching in the leg?
No, not
No.
too bad.
Are you an Arsenal fan?
I am indeed.
You are?
Shouldn't have worn this top today.
Yeah. So you guys gonna win the league this year, or is it
Funny,
or
hope
next
so.
year? You know,
Sooner rather than later would be nice.
Patrice Evra said something about Arsenal. He said, watching Arsenal is like watching Netflix. You just wait for the next season.
Story of my life.
Leave
Who
your
do you
leg loose
support?
for me. Sorry?
Do you support anyone?
Hey, my team's really not good at the moment. I don't even
So
want to
you
say.
can't talk. Giving me stick.
Leave your leg loose.
I personally think being an Arsenal supporter shows commitment.
Yeah. Any pain in the lower back or stretching
No,
in the legs?
just
No.
noticeably tight. Yeah.
Noticeably tighter.
Yeah.
Yes? Okay. I'm a United
Just through my
fan.
hamstring.
And we are really bad at the moment.
Yeah, you are.
All right. We're going to do some muscle testing, okay?
Okay.
Hold your leg for me. I'm going to push down. You're going to resist. Good. Turn your foot out. So that's a rec fem. This is psoas. Hold for me. Good. All right. We're going to test your adductor longus. So you're going to hold your leg here, and I'm going to try and pull out, okay? Good. Relax. We're going to test adductor magnus. So we're going to bend the knee. You're going to push in now. Good. Relax. Okay. Same thing here. Lift the leg up. Hold for me. I'm going to push down. Resist. It's not bad. Turn your foot out. Hold for me. This one's much
Yeah,
weaker.
noticeably
Okay.
weaker.
So that's the hip flexor, the psoas.
Yeah.
I'm going to pull out. You're going to hold for me. Go. That one's not too bad. Same thing here. Go in. Good. Relax. Okay. So psoas, not too good. Rec fem on the side is, let's say, plus minus. Okay. It's not too bad, not too good. Let's get you to turn onto your right side for me, please. Bend your bottom leg for me. Hold here. I'm going to push down. You resist for me, okay?
Yeah.
Hold. Good. Come back. I'm going to push down. Hold. Resist. That's good. Okay. Can we swap sides for me, please? So that was your glute med and your glute min. Have you ever had any muscle testing done?
A long time ago.
A long time ago, okay.
Yeah.
Hold for me. On the valved dynamometer or just manual muscle testing
Just manual
like this?
muscle testing,
Okay.
yeah.
Hold for me. Resist. This is, it's not bad, but you are trying harder, yes?
Yeah.
Okay, hold for me. Let's go. So this is glute med. Yeah. Glute min. Let's try one more time. Hold. Yeah. And glute med. Let's go. Yeah, this one's a little bit tough.
Yeah.
Okay. Let's get you face down, please. There we go. So we got a small leg length difference. All right. Let's get you to raise your right leg from your hip for me, please. All right, and down. And your left leg. Okay, so it's slightly higher. Any lower back pain when you did it on the right side and left side?
No.
Okay. Okay, so any sensitivity when I push on here?
No.
Any sensitivity when I push on there?
A little bit, yeah.
A little bit. Okay. So that is L4. Sensitive.
No, it's okay.
Sensitive.
No.
Sensitive.
Not too bad, no.
Not too bad. Okay. Okay. Sensitive.
No.
Sensitive.
No.
Okay.
Sorry.
This is going to be one side may be more ticklish than the other, okay?
Okay.
Sensitive or ticklish?
No, it's okay. I think just ticklish.
Just ticklish, okay.
Yeah.
Sensitive or ticklish?
Just ticklish.
Just ticklish.
Yeah.
Sensitive or ticklish?
Just ticklish.
Just ticklish, okay.
I'm gonna be the worst person to do this on.
No, that's fine. It's sensitive or ticklish for most people. All right. Sensitive?
No, that's fine.
Sensitive?
No.
Sensitive?
No.
Sensitive?
No.
Sensitive?
Feels just a bit tight, a bit
Tight,
needly. Yeah.
okay. Sensitive?
No.
Sensitive?
No.
Sensitive?
No.
Okay. All right. I'm going to push down. I'd like you to just hold for me, okay? Hold. Good. So that's your hamstring. I'm going to lift your leg up. Relax your back. All right. Engage your left glute now. Hold your leg there. Okay. I'm going to push down, resist. Nice. Nice and strong. Relax. I'm going to push down. I want you to resist. Trying quite hard here, eh?
Yeah, definitely trying harder on the right side.
Yes.
Noticeably.
Okay, same thing. Hold. Nice and strong. I'm going to push down, resist. Yeah,
Yeah, I struggle to keep my glute engaged in that position actually.
you do. Okay, we're just going to try one more time here. Oops, you okay?
Yeah.
All right, raise your right leg from your hip for me, please. High as you can go. There we go. And down. And then the left side. Okay. So, short leg. Okay, so this is called a passive hip extension test, and it's used to test the integrity of the joint at L5, S1. So, depending on which leg is lower, that will indicate to you that that facet joint on that side is the one which is subluxated or out of alignment. So in this case, it's the left side. And we have some sacroiliac joint dysfunction here on the right side. Okay. So your injury was at the bottom of the squat, right? Yes, just as you're
As I was coming out.
as you're
of it,
coming
yeah.
up, yeah. So this is actually where most lower back injuries in the squat occur. It's that transition between the eccentric phase to the concentric phase. Sometimes what happens is once we get into the bottom of the eccentric, we tend to relax. It's a resting position. And then when we need to come out from it, because we've lost the integrity of our stabilizers, we really force increased intra-abdominal pressure to come out from there. That increase in intra-abdominal pressure can overload the disc, okay?
Yeah.
So this is a normal disc. This is the nucleus. This is the annulus, all right? The nucleus is jelly-like. The annulus is kind of rubber-like, like a tire. And it keeps the nucleus in place, okay? This is a disc bulge, one of the most common injuries that occur in patients with lower back pain that occurred during a squat. What happens here is the load on the disc is too much, in particular on the nucleus. That pushes out on the annulus, and the annulus pushes backward. The weakest part of the disc is its posterior aspect, okay? So what can happen is a nerve root compression like this, okay? And I think this is what happened to you in the initial injury, which would explain the sharp shooting pain that you are getting in your right leg.
Yeah.
What happens from time to time is you may irritate this disc, and you may irritate the nerve, which is why you have that recurring kind of symptoms. But because the irritation is not as acute as before, you're not getting referral down your leg.
Right, okay.
However, the chronicity of irritation is what is responsible for your motor deficits in the right leg. Okay? When we do our nerve root compression tests, on both the slump and the straight leg raise, you are experiencing more tightness in the right leg compared to the left. So that will indicate some type of nerve root irritation. Okay? Now, this model here is a herniation. Okay, so I'll just explain to you the difference. Normally in a herniation, what will happen is the annulus is under constant tension, causing it to rupture, okay, or tear. And what happens is the nucleus will come out, okay? And that's what we would call a herniation, okay? I don't think you have this. I think maybe you have a disc bulge. What I think though is we need to be conscious of is the hydration of the disc, okay? You mentioned in your case history that you've never had an x-ray. You don't have any treatment on a regular basis. You're kind of managing yourself. When we did the slump test, you had more sensitivity when you put yourself into extension, okay? Yeah. And when we were doing your range of motion testing, your extension and your rotation, it's more sensitive than bending forward. Disc bulges or herniations are more sensitive when you're going forward because you increase pressure on the front of the disc. This will cause movement backward, okay? But a degenerative disc or a dehydrated disc is more sensitive in extension. Okay. All right? Because normally what we'll find, I'll show you an x-ray as an example. The posterior aspect of the disc is the one that is most narrowed in a degenerative disc. Okay? So when you elicit extension, it further narrows that gap. Okay? So this is just something that you need to be conscious of if your symptoms evolve or change over a period of time, meaning you have more episodes of lower back pain, or your symptoms evolve and you start to have more nerve root pain. Okay? Morning stiffness is also a big indicator of inflammation and of a degenerative disc. So something you need to pay attention of. All right, so that being said, what are we going to do for you today? Okay.
That's the question.
All right. You basically out of your acute phase of lower back pain, so we don't really need to do much there in terms of managing lower back pain. Yeah. Right. I will decompress your lower back. So decompression is basically a process where we take the pressure, or we play with the pressure system of the disc. Okay. We take it to a negative pressure, and what that does is it facilitates resorption. Okay. Or process of resorption where the disc can draw in fluid from the CSF, or your cerebrospinal fluid, can rehydrate itself and basically become healthier. What we're going to mainly focus on today though is we're going to focus on improving your motor control of your right limb. So we're going to work on the nervous system. We're going to use some medical acupuncture with electrostimulation. We're going to fire up your psoas, your rec fem, your glute med, your glute max, and your hamstring.
Can't wait.
It's going to be fun. All right. What happens is you have a relationship between like biomechanical injury, nociception, and proprioception. So nociception is pain. Yeah. Proprioception is joint position sense. When you have an injury that's chronic, you're going to have a chronic pain cycle. Even though you may not experience pain, your body is in a cycle of pain, but it's regulating it through exercise. When you have pain, you're going to have muscle inhibition. It's a consequence of some type of sensory overload, which is why you keep feeling this motor deficit in your right limb. Dysfunction in proprioception or joint position sense affects biomechanical functioning, which has a relationship to nociception. So you're kind of stuck in a loop. Yeah, we need to break the loop. Okay. You may find that your single leg movements are more effective after this, which would make your like the biomechanics of the injury better, which may potentially affect your episodes of pain.
Very
all right.
Interesting.
Okay. Yeah. Great. So let's start with the front of your leg, and then we'll go to the back. Okay. All right. On your back for me. Do you have any questions?
No, I don't think so. I was doing pistol squats the other day,
Can you lift your head
and
for
I
me?
can do a full pistol squat on my left side, but I physically can't
Can't.
get into the position on my right side. Is that due to everything we've just gone over?
Yes.
In terms of, okay.
Yes. So when we started our case history, I asked Rosie if she's been to a chiropractor, and she said no, and I developed this massive grin, and I think she was a little bit concerned. But I think now, and I said to you, there's kind of different types of chiropractors. This is the space which I like to play in.
Yeah.
Okay, it's kind of the chronic conditions. It's the things that we don't, or we often overlook. Okay.
Yeah.
Chiropractic manipulation can be effective in improving pain. It can be beneficial in improving muscle function, but not long term.
Okay.
What we're going to do is we're going to try to improve that muscle function and improve your pain long term here. Have you seen Andy using the newbie, or new fit?
Yeah.
Yes. This is something that you should consider as well.
Okay.
Because this is the device that I'm using here is basically a TENS
So
unit.
I've got a TENS unit at home
Yes.
that I use.
But the device that Andy is using, so Andy is my coach, and he's using a new device which is called a newbie or new fit.
Yeah.
And this is a direct current device. It goes up to like 500 hertz.
Okay.
This I think only goes up to like 200 hertz. It's a baby unit, this one. It's just to start the process, but
Yeah.
the frequency is exceptionally powerful, and you basically load, or you perform an exercise with stimulation, and that helps to solidify motor control patterns.
Okay.
That may be exceptionally beneficial
Yeah.
to you.
That is one of the things I use my TENS machine at home if that side flares up.
If it flares up,
So I put it on my glute or
So
on
this
my
will be
quads
great
or hip
for
flexors.
pain management
Yeah.
and some type of motor control.
Okay.
Okay, guys, so we've been through the explanation of what's happening with Rosie. We're going to go ahead and do some intramuscular electrostimulation. Of course, Rosie is a lady, so we want to be courteous with her. We're not going to show the electrostimulation of the limb, of the lower leg, but we will come back and we will show you guys a muscle testing after treatment. Stay tuned.
Wish me luck.
2,000 years later.
And we are back. Okay, guys, so we just did our intramuscular electrostimulation. We worked on the glute max, the glute med, the bicep femoris or hamstring. We also worked on the muscles at the front, the rec fem, the psoas, your hip flexor, and the your adductor and the Rosie's adductor muscle. So we're going to start muscle testing now, and we're going to see how she feels. Okay, so let's get you to flex here for me. Okay.
Yeah.
All right, let's get you to hold now. How does that feel?
Yeah, definitely better.
You feel like you can engage it much
Yeah,
better?
I don't feel like I'm trying as hard.
Yes. Okay. Lift up here. Hold, squeeze that glute. Hold. Right, I'm going to push down, resist. Resist, resist, resist. How does that feel?
Yeah, better. Hamstrings cramping a little bit.
Hamstrings cramping up. Okay. All right. Let's get you on your back for me, please. So, lift. It's not 100%, right? But it's quite a massive improvement. All right. Let's check out rec fem. Hold for me, please. I'm going to push down, resist. Resist, resist, resist. That's pretty good. So as this was the weakest one, let's hold for me. Much
That feels
better.
much better, yeah.
Yes. Now, psoas is a primary hip flexor, secondary lumbar stabilizer. When it's overworked, it will tend to not do one function.
Yeah.
Okay. Often it stops stabilizing the lower back, right?
Yeah.
So that is where you will have some triggers in lower back pain, you know, when all the muscles in a hierarchical system are not operating as they should. That's also where motor control comes in, okay? So we're going to decompress your lower back, and then we'll end with some manipulation.
Okay.
All right?
Plan.
Guys, remember, please, if you like what you see, hit the like button, subscribe, and drop any questions or queries in the comment section. All right? Let's get you to turn over for me, please. Thank you. Inhale, exhale. Inhale, exhale. Any sensitivity? Inhale, exhale. Now,
No.
inhale, exhale. Inhale, exhale. Inhale, exhale. How's that?
That's okay.
It's okay?
Yeah.
All right. Have you ever used reverse hyper?
Yeah.
And how often do you use that?
To be honest, rarely anymore.
Rarely.
Yeah.
I would say that a reverse hyper is probably better than dead hangs.
Okay.
But you got to get the technique right.
Yeah.
When I say it's better, I think it's better at decompressing the disc.
Right. Okay.
Because it's similar to, so the technique I'm using now is called Cox flexion distraction.
Okay.
We know this technique facilitates spinal decompression, and I think reverse hyper is as close to Cox technique as you're going to get. Okay. Inhale, exhale. Inhale, exhale. Inhale, exhale. Any sensitivity?
A small amount.
Inhale, exhale. Inhale, exhale. Great, and relax. So this is an impulse adjuster.
Okay.
It delivers the same type of impulse that we would if we perform a spinal manipulation. So I got to wait 10 to 20 seconds between decompression intervals.
Yeah.
Instead of not doing anything, I use the impulse adjuster. What this will do is the impulse of a manipulation wakes up the muscles that are stabilizing your spine.
Okay.
Your interspinal or intersegmental stabilizers, your erector spinae, your multifidi muscles.
Yeah.
So we're trying to layer treatment as much as possible. We're working on the disc or the joint.
Yeah.
We're working on the muscles that are stabilizing the disc and joint. We don't want to waste any time. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. And rest. You good?
Yeah.
Okay. All right, let's check out your leg length now. All right, that's perfect. So you had a shorter left leg, and just by working on the muscular dysfunction on the right hip and decompressing, we've been able to change that leg length inequality. Okay, let's have a look at your passive hip extension test now. Can you raise your right leg from your hip for me? Okay, great. And down, and your left leg. Much better. Okay,
Yeah.
let's get some manipulation in now. So it's your first time doing manipulation, right?
Yeah.
Okay. You excited?
No.
All right. Let's get you to turn to your side for me, please. Oh. Okay, let's get your hips to the edge of the bed for me. Okay. Straighten your legs for me, please. There we go. Leave this leg loose. Can I have your bottom hand, please? Okay. Inhale and exhale. You good?
Yeah.
All right. Let's get you to turn that way. Come to the edge for me, please. Come, come, come. Okay. Bottom hand, please. Okay. Let this knee slide. Inhale. Exhale. You good?
Yeah.
All right. On your back, please. Sit for me. 1 second. This is the best one.
Oh God. Is that good for me or not?
It's good for you. On your back, please. This is the one you never knew you needed.
Okay, I'm ready for it.
Bend your knees for me, please. Cross your arms. Just scoot over to the edge for me. There we go. Lift your head. Okay. Leave your body loose. Inhale. Exhale. Inhale. Exhale. There we go. You good?
Oh, yeah.
All right, let's get you to sit for me. Swing your legs over. Let's get you to stand, please. All right, you're going to face that way. Let's retest your range of motion. Okay, so you were experiencing tightness in lateral flexion. How does that feel?
Yeah, much better.
Again here. How does that feel? Good. Okay, so rotation. How's the tightness there?
That's fine.
Any tightness at all?
No, that's fine.
No? Here. Good. Here.
No, it's good.
Good?
Yeah.
All right. Let's do one more test. Can you lie face down for me? I just want to test your hip extension and then we're good to go. All right. Let's get you to raise your right leg from your hip. Okay, down. Left leg from your hip. That's better. Perfect. That's the same. All right. You can take a seat for me.
Woo.
Let's do a nerve compression test. Okay. So, straighten your left leg for me. Toes towards you. Okay.
Yeah.
Just take note of how that feels. Relax. Right leg. Toes towards you. Is that different to before?
Yeah.
Yeah?
Not as tight in the hamstring.
Not as tight in the hamstring. Okay? And all we did was we reduced the sensitivity of the nerve. Okay?
Yeah.
Part of the electrostimulation to fire up the hamstring is that it's going to reduce the nerve sensitivity. Just changes the frequency at which the nerve is operating. Okay?
Yeah.
Okay, guys, that brings an end to our session today. I hope you found that interesting. Rosie, would you like to let our followers know where they can find you on social media?
Of course, so my main platform is just my Instagram, so it is rv.fitness1. You'll see my brand is Train Smart Online Coaching. If you're Dubai based, I do one-to-one coaching as well, but my main platform is online.
All right, guys, thank you very much for watching. Please hit the subscribe button, like, and drop any comments you may have in the comment section. We'll see you soon. Take care.